Hi, my name is Sarah Mintz. I'll be doing my presentation on my time at Premier Pain Solutions here in Wilmington. Premier Pain Solutions' mission is to provide satisfactory relief for patients from acute and chronic pain. Their goal is to provide patients with care using holistic and multidisciplinary approaches by working together with other interdisciplinary teams of specialists. Their structures provide patients with a pain-free living environment, as well as being able to be non-dependent on medication through education and the latest medical research. The population that they serve are patients who are looking for pain management options for their acute or chronic pain. They have multiple offices across North and South Carolina, such as Asheville, Columbus, Wilmington, and Southern Pines, as well as Greenwood and Easy, South Carolina. Premier Pain Solutions is a state-funded clinic. Some of the conditions that they treat are cancer pains, chronic pains, failed spine surgeries, reflex sympathetic dystrophy, occipital neuralgia, fibromyalgia, and headaches. To treat these conditions, they use epidural injections, joint injections, nerve blocks, kyphoplasty, Botox, stem cell therapy, and radiofrequency ablations to treat those pains. The physicians on staff is Dr. Christopher Mallard, who completed his anesthesia residency at University of Kentucky. Also, Miss Kathy Lewis attended Southeastern Community College for a degree in nursing, and then she began her career. Later on, she attended Barton College to receive her Bachelor's of Science in Nursing, and then received her Master's from UNC Greensboro. Medical assistants on staff are Hannah Wagner, Rose Reese, Nate Jones, and Couture Newkirk. Couture serves as the site supervisor, making sure that the day-to-day activity is going well and smoothly for both patients and the physicians. Rose and Nate work with nurse practitioner Kathy to help get through new medication refills as well as patient follow-ups. Hannah Wagner works with Dr. Mallard during procedures, making sure that he's using the right tools and making sure he's entering the right spots by using x-rays. All our procedures are done under x-ray, and they're able to be done in office. During my time there, my responsibilities were to make sure I was updating patient charts using the eClinical work system, scheduling and ordering procedures, as well as imaging and sending referrals. I was also able to triage patients and do new patient workups. And with those, I was having to collect vitals, verify pill counts, and then review and verify patient history. And then afterwards, I would give report to either Dr. Mallard or Nurse Kathy, depending on whose service I was with. New patient workups, you had to either go by their new patient information that they fill out or go through their charts and find their referral list. And during that time, you'd also have to do a master risk log, which is what's shown in the two pictures on the right. A master risk log, it serves as a document for doctors to know what prescriptions they need to prescribe, to know what factors influence the patient's health. While I was there, the projects that I worked on were making sure that procedure baskets were ready for procedures each day, as well as doing web authorizations. Web authorizations were the ways that other physicians would send in referrals or send in patient charts for doctors to review, as well as sending over imaging or ordering imaging, stuff like that. Procedures that I was able to watch were trigger point injections, radiofrequency ablations, Botox injections, the set joint injections, and medial branch blocks. The medial branch blocks were the beginning point for the ablations because they would numb the area, and as long as a patient showed at least 50% of relief during both sets of procedures, then they were a candidate for the radiofrequency ablations, which burned the nerves. During my time there, I also thought it was important learning the e-clinical work system to see how that is utilized every day. Learning the different medications that has helped me during one of my classes this past semester, as well as learning and observing procedures, and then learning the day-to-day operations of the clinic and seeing how they function, how they run to serve patients. My favorites being there was observing the procedures, as well making procedure baskets, because those were helping the flow of work go by easier, as well as doing patient follow-ups. I got to a point where I would get through patients quick and effectively and be able to help out more and more. My least favorite was doing the new patient information, because sometimes there was not a referral note in their chart. So you either had to type in what they had written off their new patient information, or if they did not fill that out, you'd have to sit there and go through that piece by piece with the patient to verify everything. Those took me on average about 30 minutes to get through. They were time consuming, but I was able to learn the eClinical work system. Virtual patient visits, they used DoxyMe to complete those. Those were issues. There were issues to where patients were not able to see or hear us, or we would not be able to see or hear them due to connection. So that was a difficult trying to get through those, because you would get backed up trying to do in-person and virtual visits. My most memorable was, it was one morning, it was 8 o'clock, it was before we started seeing patients with an internet outage. So all the phones were down and we could not get into the eClinical work system. So we were having to pretty much hand chart information at first. And then right after that, we were able to get connected to our hotspots on our phones to continue seeing patients virtually. Public health domains that were covered was the overview of public health systems, being able to see the framework and how they work day to day. Health communications for scheduling and charting. They use podium reminders to send out reminders about patient visits, as well as sending links to DoxyMe, which was how they did their virtual visits. Human health was also used because we were able to triage patients and help promote their health and making sure they were on the right track. And then identifying and addressing population health challenges, being able to sit down with the patient to learn about any new changes they've had in medication or any history or surgeries, and being able to identify what needed to be brought to the physician's attention. As well as the role and importance of data in public health, being able to request patient charts, being able to use the eClinical work system to update patient information, as well as sending out referrals, ordering procedures, and imaging. Health policy, law, and ethics and economics was used by keeping the charts covered, making sure that you're following HIPAA guidelines and not sharing any patient information. And then the determinants of health would have been our master risk logs. And that was just a way for doctors to figure out what factors and what risk a patient might be for a medication addiction or dependence. During my time there, I really enjoyed being able to learn the ins and outs of the clinic and being able to help in any way, whether it was trying to get patients checked in, getting their vitals, doing their pre-screening, or even making the procedure baskets to help get things moving effectively.